coming in large numbers this morning. I'd like us to remain standing.
It's a pleasure to be here in the north with you all, and thank you for the beautiful prayer that we had, and thank you for your presence here this morning. To all the stakeholders, thank you very much for being here, and first of all, please, to all the medical staff of the Northern Division, I'd like to put on record my sincere appreciation to the work that you do in serving our people of the North. So please convey my best wishes and appreciation to all the medical staff, from Mombasa Hospital all the way across to the health centers and the various nursing stations we have in the North. Thank you very much for the work that you do. And I'm sure you'll agree with me that there's a lot of work that needs to be done. A special thank you to all the children who are here. I know it's that time of the school holidays where you want to stay home and watch TV and do the things that you love, but you have been the chosen few to be here, and I was very much impressed by the theme of this camp here, which says, "It won't stop my dream." And I sincerely believe nothing should stop your dream. Whether you're a child or whether you're an adult, whether you're a man or woman, whether you're a girl or a boy, whether you're able or disabled, nothing should ever stop anybody's dream. And especially for our children here this morning, well, I wish and pray that whatever dreams that you have, may the Almighty bless you with the strength and the power and the wisdom so that you can achieve your dreams. Keep smiling. It's good to see you smiling. So, ladies and gentlemen, coming to this morning's program, I think we are going to address some very important issues like NCDs, rheumatic heart disease, and TB. These are not new issues to our people, and especially to those in the medical field. These are issues that we need to address, and I'm so glad that you have chosen our little ones present here so that they can be champions of this. They can go back to the schools. First of all, it has to start with them. If they are healthy, if they are aware of what is to be done, if they are aware of what conditions they have, if they are aware of the lines of treatment that we have, if they are aware of the medical help and support that is available by the various stakeholders present here today, I'm sure they will not only be champions of their own health, but they will go out in the community, they will go out in the school and become champions for good health. Okay, so thank you very much. It is also very important that we as individuals understand and are aware of the risks certain diseases pose to us. Okay, and before I move on to diabetes and RHD and tuberculosis, I would also like to thank the team. Have we started the MENSI program here? Yes, the MENSI vaccination program that the medical team is doing. I'd like to thank them for that. It has been a very successful program, and I'm sure we'll reach out to all between 1 and 19 years old in the coming months to ensure that we safely vaccine our population from 1 year to 19 years old. You're aware that people have died because of that. And that's the reason why the government of the day decided to vaccine all between 1 to 19 years old, and hopefully we will be able to prevent further deaths. But again, a humble plea to the members of the public, to the medical professionals and staff, keep creating that awareness. We really need to keep telling people about the risks associated with meningitis, okay? And we don't want to actually lose any more Fijians to this deadly disease. So all in all, ladies and gentlemen, this camp that you're going to have for 2 days is basically a good platform to empower our children, okay? And so to all the stakeholders, thank you for your commitment and partnership with the Ministry of Health. And I'm sure you will be able to provide opportunities for information sharing, networking, and of course enabling our children, our people to boost their livelihoods. And again, thank you very much to the young people who have been selected, like I've said. Diabetes Fiji, thank you very much. And the rheumatic heart disease program and the TB unit, thank you very much for that. Ladies and gentlemen, before we begin, I think we need to take our health very seriously. That's very important. Each one of us have to understand that health is very important. You know how we have this saying, health is wealth? Obviously, I think that's very true to us. And some of us do not realize how important it is for us to be healthy unless and until we become sick. We take it for granted. Oh, I'm not going to be sick. You know, it's, oh, we'll deal with it when it comes to it. But when we actually get sick, then it scares the life out of us. And then we rush to hospitals and health centers, and sometimes it's very late. sometimes it's too late, and then we start this blame game and stuff. So every individual needs to be responsible for their health. And again, why are we targeting children? I mean, I strongly believe that these young children could be good ambassadors for health. It is very easy to mold their minds and take them in the right path. We adults sometimes have a hard task of changing our behavior. For example, if you tell a smoker smoking is bad for health, and because that person has been smoking for so long, it's going to be very difficult for us to stop smoking. And even for a smoker, it would be very difficult to quit smoking, or if somebody consumes a lot of alcohol. So these habits, ladies and gentlemen, we need to stop at a very early age. We need to ensure that our young children do not get into these habits. Obviously, there are other sicknesses that just come naturally. That's a different story. We can cure them with medications. But lifestyle habits, smoking, excessive alcohol, overeating or undereating, these are things that is within our control, and we can change them. So I think we can, as medical professions, as adults, as parents, we can influence a change in the behavior of our children. And that is very important. I think the whole idea behind this camp was to see that we target our children and see that the behavior is managed at a very young age. So looking at diabetes, we hear about this, NCDs, I think everybody hears about NCDs. You hear about diabetes, you hear about high blood pressure, you hear simple things like, oh, somebody had a heart attack and died, somebody's leg got amputated, things like that. How do we come about these things? Again, coming back to lifestyle diseases. If you look at us in the Pacific people, I think a lot has to do with our eating habits, a lot has to do with our lifestyle, and a lot has to do with the type and the amount of food that we eat. We either eat too much, we either eat too little, or we either eat at the wrong time, or sometimes we don't eat at all. For a simple example, when children leave home for school, as parents, how much time do we devote to actually preparing a healthy breakfast for our kids? How many of us actually take time to pack healthy meals for our children? We'll have to think about this thing. We're always rushing. We're rushing to work. I understand people have to work, but again, we have to manage time. We have to eat healthy. We have to eat at the right time, and we have to eat at the right amount. So that's very important. So if we are talking about diabetes, we look at types of diabetes that we have. The first one we look at is type 1 diabetes, where our body is not able to produce enough insulin. And then we have the type 2 diabetes, where the cells of your body are resistant to insulin. So whether you produce enough or not, whether your body is resistant to insulin, these bring about a lot of health complications. And of course, then we know pregnant mothers, the pregnant, sometimes they have diabetes when they're pregnant, but that goes away after the birth of the child. So simple things like that, and we want people to know that. So I have been told that most of the children here at the camp would probably have a type 1 type of diabetes. Okay? And this is usually diagnosed with children. Now, if you look at statistics in Fiji, if you look at the number in Fiji, the total number of people living with type 1 disease from year 2014 to year 2012 currently stands at 500. Well, that's a big number. And like we've said, it's common with children. And the youngest person living with type 1 diabetes in the north is 10 years old. I've been told, what? Yeah, 10 years old. So we have the youngest diabetes type 1 patient in the north is 10 years old. 10 years old. It's too young, huh? Too young. And the youngest person living with gestational diabetes mellitus in the north is 19 years old. So that's just the north figures. And these are the figures that come because they come and report to the health centers and we are able to detect that. But can you imagine the numbers out there that are underreported? So we need to bring these people closer to our hospitals and health centers so that they could be advised as to how to go about managing this. If you have a condition, it's very important that we manage it. And so of course, it's a big concern for us if our people are suffering from diseases and the numbers are increasing. So we have diabetes, we have high blood pressure. Then we basically talk about sugar and salt and fats. That's what we are talking about. The enemies of good health, the culprits of good health is sugar, salt, and probably fats, lack of exercise. What do we do? That's the question. What do we do? We need to motivate our people. Like I said, we need to motivate our people that their health is very important. We want few people to come to hospitals and health centers. We want people to be healthy. The fewer, if less numbers attend to the hospitals and health centers, it doesn't mean people are healthy. It could probably mean people are not going for their regular checks and stuff like that. So we need to create a balance in that. So basically, you will have to listen to your doctor's advice. Okay? Everybody needs to listen to the doctor's advice. Regular checks. If you are on medication, take regular medication. If the doctor says you need to take medication before food, then have to take it before food. Not that you forget it in the morning, you take 2 in the afternoon, or you take 2 in the night. So these are some of the beliefs we have. Yeah, my mother is 70 years old, diabetic. You know what she'll tell us? So she'll say, Mom, stop eating that. So if she has one sweet, she'll say, let me drink 3 glasses of water. She said, let me drink 3 glasses of water. I said, no, you shouldn't be taking that. So it's just the desire for us to eat as the other one is eating. So if I have high blood pressure and my doctor says don't take salt, and I don't want to eat, I want food with a lot of salt and stuff, again, what am I doing to myself? I'm putting myself in danger. Okay, so that's very important. Again, if you look at the budget that the Minister of Health gets, okay, we get a lot of budget to ensure that we create a lot of advocacy programs. And I'm sure in the long run, we will be able to advise our people and make them more aware of their health. And again, talking about diabetes, we have people who knock on our doors for dialysis assistance. And that's a very sad case too. We are losing people to end-stage kidney failure, end-stage renal diseases. Sometimes it's just too late. And you need dialysis. And in Fiji, it's a fact. There's nothing to hide. Dialysis is very expensive. I think people in the north, through the services provided by the Board of Visitors at Lambasa Hospital, you are lucky that you pay $150 per session. And every person who needs dialysis, purifying their blood, you need 3 sessions per day, 3 sessions per week. So you're basically looking at $450, apart from the other medication that we have. And some people don't even earn that much. So for me, dialysis is not the solution. For me, it's keeping people off dialysis, living a healthy life so that you don't need that service. But again, given the fact that our people need this service, the government in this year's budget has come up with a subsidizing cost. And we will subsidize 50% of the cost of dialysis for those earning below 30,000, right? Yeah, I guess so. So if you earn below 30,000, yes, if you earn below $30,000 and you need dialysis treatment, we will pay half the cost of that for every session that you do. So in Lambasa, for that matter, it's $150. Now you will only be paying $75, and as a government, we will subsidize this. A lot of people say, why can't you make it free? So, I mean, can you look at the logic behind that? Everybody will go for dialysis, they will not try to look after their health. We want people to look after their health. Now, the option to dialysis is kidney transplant. We don't do kidney transplant in Fiji. We don't do kidney transplant in Fiji. Kidney transplant is done in other countries like India, Australia, New Zealand, and the rest of the world. One patient in Fiji has to pay about 60,000 Fijian dollars for a kidney transplant. That includes the transplant, that includes the airfares, that includes the 3-month or 4-month accommodation, that includes other complication that arises, that includes the medicine that you need after dialysis, kidney transplant. But for kidney transplant, you need a kidney. You need a kidney. Who's going to give you the kidney? Maybe a relative that's close to you, but a lot of people don't want to give the kidneys. So these are some of the issues. So using young children to promote good health, I think it's the way forward. But I just wanted you to know some of the issues that we have when it comes to diabetes. So ladies and gentlemen, next we come to the rheumatic heart disease, RHD. Again, it's a chronic damage to the valves of the heart. And again, this is curable, right? In Fiji, 1 child in nearly every classroom has confirmed RHD. And according to the current National RHD register, there are almost 3,500 people living with RHD in Fiji. And that's a fact. Again, reported cases. The reported cases are there. So we encourage people to come in. And in the north, I have been told that there are 800 people who have been diagnosed with RHD. Again, a big number. 800 children, 800 people, it's a big number. So for RHD, we encourage children to take their benza. And I'm sure we have some children here that are onto that. Okay, good. So what the benza does is the benza medicine kills the strep germ and keeps your heart well. So we advise those suffering from RHD to take their benza every month, and it will protect you from complications such as heart failure and stroke. And of course, as health professionals, nurses and doctors, we need to keep a track that our patients are in line with their benza medication. Again, we have allocated about $40,000 to the RHD program, and we work with Kiwa Kids to ensure that we reach out to the communities and protect our children from that. Ladies and gentlemen, then we move on to TB. Okay, one of the rationale behind this camp is to also ensure that people are aware of TB. TB, tuberculosis, again, it attacks your lungs, but can also attack any part of the body, such as your kidney, spine, and the brain. Again, very deadly, very deadly. Spread, very easily spread from one person to the next. You cough, you spit, you put the germs into the air, and one of us has to take it in. So again, Fiji has a medium burden of disease with about 59 cases of TB per 100,000 people. This is according to WHO report 2018. Last year, we recorded 358 cases of TB, of which 60% were from the Central and the Eastern Division, 30% from the West, and in North, we had 36 cases of TB recorded. And children represented about 56 cases overall for statistics figures. Okay, so TB deaths annually stands about 26 per year. So we lose about 26 people to TB every year. We can prevent that. So ladies and gentlemen, diabetic represents a significant risk to TB control efforts in Fiji, as a diabetic, I've been told, is 3 times more likely to develop TB if becomes affected. This year's budget, we have allocated about $500,000 to enable national awareness and education and administration of services for TB patients and specialist care in Lambasa, Totoka, Tamavua, Suva. And of course, our other health facilities, what they do is provide TB tests, treatment advices, and community-based screenings and awareness, and we will continue with that. Again, I'd like to thank the outreach teams that go out visiting people in communities and carrying out awareness and advocacy programs. So 3 conditions. Of course, there are many other conditions that are affecting us on a daily basis, but the whole rationale behind the camp is to target on RHD, TB, and diabetes. And apart from that, to the children who are here, I'm sure this will help you know each other better, right? You will network, you can talk to people, how they manage their conditions, you can talk to the medical staff, and go back to your homes and go back to your schools and become ambassadors of this. And I've been told that tomorrow in the Coral Coast, 25 other students with the RH Rheumatic Heart Disease team will be meeting, and they will also be part of a 2 days media advocacy training. They will be taught how to speak in public about these diseases. Maybe me and my staff talking will not do much, but if you come out and talk as a little boy or a little girl, as a student, you come out and talk and share your experiences with the public, maybe that'll have more impact. So the whole idea of the media advocacy training that's happening in Coral Coast from tomorrow is to prepare children like you to become good speakers and communicate to others who might be suffering from RHD. So ladies and gentlemen, I believe that the patient voice is more powerful today. As a patient, if you talk. As a survivor, if you talk. Okay? It has more impact on the people, and that's what we are trying to do. We are trying to get people serious into thinking about this thing. Serious. Sometimes, I'll give you an example of diabetes. Okay? People are very careless when in managing diabetes. Like I said, they don't take the medicine on time, or don't take the medicine at all. Eat whatever you want to eat and drink and smoke. And say, oh, you go to the doctor, and doctor says, well, your diabetes is not managed. And suddenly a stage comes when your legs have to be amputated, or you develop a sore or something like that, and your legs have to be amputated. And then we see the fuss that comes from the families. Oh no, why did the doctor? I have a lot of cases on my table where people question me, why was my family's legs amputated? It's a very hard thing explaining to them the control measures that the doctors are doing there so that you could live longer. But we shouldn't get to that stage, do we? Food management. If they say, well, if you're a diabetic, your food loses its senses. In simple terms, you lose your feelings in your food. So they say, make sure you don't walk outside without shoes, simple things like that. So you have an infection of the leg. That infection develops gangrene. I've started learning all these medical terms. So you have dry gangrene, and you have all this gangrene coming up, and suddenly you have to lose the toe. If you don't lose the toe, you will lose the limb. If you don't lose that, it goes up, and then probably you lose your life. Things like that. So we don't want that situation to arise. There are medicines available, people. The doctors are available to give you advice. We have lots of fresh fruits and vegetables around. Eat, control your diet. What is it somebody told me about health? 3 M's. What is it? Mouth, muscle and mind, Mouth, muscle and mind. 3 important things, remember. What you eat, exercise your muscles, and what the mind tells you, discipline. So if you have that, and you know my doctor said not to eat sugar, not to put sugar in my tea, don't put it. If the doctor says eat less salt, then don't put extra salt. If the doctor says don't eat fatty foods, then don't eat fatty foods. Oh, you have a carnival next week, right? There's a carnival going on next week. I'm sure the team will be there too. This year's Hibiscus Carnival, we've recorded the most number of people who visited our tents in Valelevu. Day in, day out, people come for the health checks, which is good. But what happens after that? If the doctor tells you your blood sugar is high during one of the screenings, what do? You go visit and you get advice, stuff like that. But I think it just stops there. We're trying to bring services close to you. We're building health centers, we're building hospitals, we're building nursing stations. We're using our staff to go out and about to each community. We're bringing the service to you. I mean, there used to be time when you travel hours and hours to reach the health center or the hospital. Now we have close to 189 health facilities, including the bigger hospitals, the nursing stations. So we have community health workers who actually go out in the community and advocate for these things. We have 1,790 close to community health workers based in the community. Now, for the first time in this year's budget, for the first time in the history of a Ministry of Health budget, we have a budget allocation to pay our community health workers. These are trained by our medical staff, and now we will be paying them $200 a month for the services they provide. So community health workers are more part of the community. So we will have to use them for these advocacy things. There's a lot we are doing, people. There's a lot we are doing. We want you to reach out as a public and use these opportunities to better the health or the lives of your children and yourself. Free medicine scheme for those people who have not registered, please do so. Register as part of the government initiative. We have close to 140 medicine on the free medicine list. But this medicine is also available in our hospitals, in our health centers. But with that program, what happens if you are registered, if the doctor says you need that medicine and it is part of that 142 list, you go to a pharmacy and you will get it. We are working with the private pharmacies to see that if a person goes to the pharmacy, they will give you the medicine from the stock, and we as a government will pay for that. Only the ones listed. So you can't go to a pharmacy and say, I want all these things. No, there's only 142 lists. So there are a lot of things we are doing to ensure that we help you look after your health. But at the end of the day, it is you and I. It is you and I, and of course your doctor who gives you advice. Right, so ladies and gentlemen, it's very encouraging to see this camp here in the north, and I think we are moving we are headed in the new direction where we are going to use children to become advocates for health. We are going to use children to get our public more serious about talking about diabetes and rheumatic heart disease and TB, and I'm sure as you grow up, not only will you be healthy, all the children present here, but you will make a big difference in the lives of your families and your colleagues when you go back to school. I think we need to expand that, going back to schools, and use these children who have been trained in the camp for them to probably present to their peers in the school. And I look forward to seeing that with the Ministry of Education. We can look at doing that. Okay, so I believe this is for all the children who are part of the camp. When you finish your 2 days camp, you will become more sort of more educated. You'll have more knowledge about how to handle your conditions, and of course, like I said, and become more of our mouthpiece to the community at large. So thank you all for being here this beautiful Thursday morning. After 2 days, I'm sure the children will go back and enjoy their holidays. Looking forward to that. And to all the medical staff, to all our stakeholders present here today, to the organizers, thank you very much. And yeah, God bless Fiji. Thank you.
So on behalf of the camp participants, the young people, like to thank the Minister for Medical and for Health and Medical ambassadors in the community. When you go back to your schools, your homes, your communities, about what you about your health, about the conditions that you learn, about sincere gratitude to the Honorable Minister. And I'd like now to invite
everybody, if we could have a group photo just up front before.
This is good for me. I do that. This is no, I don't have time for that.
And these are some of the they usually demonstrate.
I think we need to focus more on this, like the misconception that you eat fruits and vegetables. Canteen, but they're selling something.
Just give you
Yeah, but that's MSP.
MSP. Sorry, MSP.
Oh, okay.
Yes. We don't want the girls having unplanned pregnancy and then having complications during labor, because that will try and
Are you training people?
yeah.
Make sure there are other people who are trained. Everybody needs to check my heart before my heart collapses. Take care.
Yeah. Smile.
Okay.
Okay. 1, 2.